Welcome to the NBNU podcast. My name is Alex Saunier. I'm here on behalf of Joanne Quinn as your podcast host, and today we're talking about what it's actually like to be a man in nursing, what draws people to the profession, how those experiences evolve over time, and what people often get wrong. Nursing remains a predominantly female profession, and that makes it even more important to hear from members whose experience may not always be reflected as often. We're joined today by Patrick and Jason, both members of our board of directors who bring perspectives from different areas of nursing across New Brunswick. Thank you both for being here, and we're really just looking to have an open conversation today about your experiences in the profession. There's no right or wrong answers here. It's just about what it's been like for you in your own words. So Patrick, Jason, thanks again for joining us. To start us off, maybe you could each introduce yourselves and the kind of work you do.
I'm Patrick Gallant. I did numerous roles in nursing since the late 2000, probably 2008. I started as a PSW first, and then after a few years, I wanted to pursue my career. So then I went to do the LPN program at the CCNB in Dieppe. And after that, I wanted to pursue again. So I went to university and did the bridging and graduated in 2020. And now I'm part of the union that I got involved very early. And I became the Part 3 rep for the hospital at the NBNU board.
That's amazing. And what kind of nursing do you practice now? Where do you work?
Right now, I'm in orthopedic. Originally, I started in emergency and medicine unit, and then I transferred to ortho, which there was no job back in the day. And so I was just filling in a temporary, and I went to dialysis for 3 years. And then I came back to ortho in 2017, and it was supposed to be short term, but I'm still there.
That's fantastic. And Jason, how about you tell us a little bit about your background?
My name's Jason Robin. I'm originally from Northern Ontario. I'm a transplant. I came to New Brunswick in 2012. I did my nursing program in Timmins, Ontario. So there's a collaborative program up there with Laurentian University. And graduated, moved out here with my girlfriend at the time. Right now, I'm working geriatrics at a nursing home. I've been there for 14 years. I also did 10 years of casual acute psychiatry. And I've been involved with the union probably over 10 years now. I took a 1-year sabbatical from the nursing home, worked as a labor relations officer covering a mat leave at NBNU. And that's my story so far.
And then you returned to your long-term relationship, 14 years in a nursing home, and now 15 probably.
I definitely missed my residence at the nursing home, so I'm glad to be back there.
Fantastic. And if you could both just talk about what drew you to nursing and how that experience maybe evolved over time. But I guess I'll keep it to a one-part discussion prompter. And if you could speak about what drew you to nursing.
I can go first. Patrick and I were kind of talking about this before, and I don't think we're the poster children for Florence Nightingale. Honestly, I have nobody that's gone to post-secondary in my family. My dad's a carpenter, owns his own little construction business. I used to work with him, and he's always pushed that I don't want to work outside in the wintertime. I think that's just what he didn't want to do anymore. So I also played quite a bit of hockey, played junior hockey, and one of my team managers, she was a nurse, one of my friend's moms, and she really introduced me to nursing, the idea of it, and I applied to the local program at the community college and got in. So really, I didn't know too much about nursing before I got in. I knew it paid well. I knew it had benefits. It had a pension. I could work anywhere in the country, and that kind of was enticing to me at the time.
That's amazing. And how about you, Patrick?
Me, at the beginning, I didn't want anything to do with nursing, to be honest. And I'm a second generation of nurse. Like, my mother was a nurse active for over 40 years in a nursing home. And she never pushed a career on me. She said, I don't care what you do, but as long as you love your job. So she never pushed it, but then I started to be interesting more probably when I was 20, 22 in the nursing career. She told me, go work in a special care home, see how you like it. And I introduced myself to those jobs, and I really liked the working with people of it. So then she's like, well, maybe you could try like the TCNB or NBCC first and see how you like the job. And I did that. And it was to be honest, the best move I ever did, because I was actually very good at my job and I love going to work. So then she encouraged me to go to UDM campus of Moncton, where she graduated also from in 1983. And me, I got my diploma actually 2020. So I was a late bloomer because I'm 38. So but it's never too late to join a profession. And yeah, that's my story.
And it's worked out beautifully. And maybe since we're speaking about men in nursing, because obviously it's a predominantly female occupied profession, and I'm sure that you saw that very early on in your educational journeys. And would you like to maybe speak a little bit about that?
Yes, actually. Well, when I went to CCNB and VCC, uh, since it was prominently female-dominated industry, there was programs and bursaries available. So all my tuition was paid because I was a male in this industry. So I had no tuition at all for my 2 years at college at first, which made the transition more at ease because it's really female dominated industry. I would say probably we're 10% of the nurses are male. So it's 1 out of 10. But yeah, I was very excited to try it out and I loved it.
Yeah, and that's very interesting. And it's the same thing with any profession that's dominated by one gender over another. You don't necessarily want to leave half the potential talent on the table, especially in a field like nursing, when there's such a need for more people. And being a man or being a woman, it does not matter to your potential as a nurse. There's way more that goes into it than that. And so maybe Jason, you could speak a little bit about your experience as well.
Yeah, there's 3 out of the 40 in my class when I first started were, males. You kind of develop a bit of a camaraderie with your other fellow nurses. I don't know what you want to call them, but at least in my course we did. And it's like any other profession. Yeah, you're speaking about, leaving 50% of the talent on the table. The profession's evolved so drastically from, when it started back in the day. There's a role for anybody. You look at politics, they're looking for 50%, females in that, and it gives a whole different lens. It gives representation. So, I think that men have a lot to offer when it comes to nursing. There's a lot of different roles that, we can excel at and really contribute and provide better care for the patients.
How would you say it's affected your interactions with, especially your patients, your clients, your residents? I would imagine that different perspective would also serve you well, especially with not just your male patients, but all of your patients or residents.
Yeah, I mean, I don't notice any difference. I go in, I provide the care they need. I meet them where they're at. It's about what energy you bring into the room and trying to build that trust. So
when you were talking about that, understanding that you don't know any different, you have nothing to compare it to.
I mean, this is my version of nursing. So it's I don't know what it's like to nurse as a female, right? So this is the care I'm providing. I guess it's kind of like you don't know what might be the difference between someone being a nurse at 25 versus 60, right? It's two different spectrums. I'll eventually find out what it's like to nurse at an older age, because I definitely know what it was like to nurse as a young guy. So it's interesting how that changes over time. Same like now I'm a dad, so that's a whole other lens that I now can put on nursing and life, right? So it evolves.
Absolutely. Patrick, would you say that your patients is it something that you just observe in day-to-day life? Like how maybe your patients respond to you versus other nurses, or is it something that, like Jason, it's really you have no comparison to draw that you can notice because you only have your own experience to draw from?
Well, I'm sure like that, and me and Jason's background is completely different, but in the hospital settings, as automatically when I enter a room, most people assume I'm the doctor. But even though I always have my RN badge, so they always think I'm the doctor and say, no, I'm your nurse. And they understand like we're here for the patients or the residents in Jason's case. And it's something you always have to explain to them. No, I'm your nurse today, and you'll have the odd time. Sometime they they won't be comfortable having a man, or we'll have people that will not want a woman as a nurse. So if they don't feel comfortable, we'll never push that on anybody, and we do the search because we don't know their trauma or their background, and so we have to respect that, and we accommodate for that.
Yeah, and to add to what Pat said, he's probably got a way quicker turnover in patients, right? Like they're not staying for extended periods of time. You don't get to know their middle names and what their kids' names are, and and where in my setting they might be there for years. So you really get to know them. You build that trust, that rapport, day in, day out. So it's a totally different approach to maybe how you're interacting with the patient's residents, clients, whoever you're serving.
Yes, definitely.
Absolutely. And that's really interesting because, especially Patrick, what you said about you walk in, people assume you're a doctor. And I'm sure that that's an experience that's quite common. And maybe you could speak a little bit more about what sort of response do you get when you say like, oh, I'm a nurse, and I'm sure it's all over the map.
Their response is actually always well taken. There was never any issue with it because I always wear my badge also. But no, the response very good to it, and they always say like the patients they're so appreciative. They're said like, well, there's something for sure. There's always gonna be work, and we need everybody we can get to help us during these difficult times. So they're very appreciative that I'm a male nurse or a nurse, like Jason said. It's not a common term that I use. Maybe it's because I'm French, but no, and they know the main goal is for them. So as long as you're getting good care and compassionate care, it don't matter who giving you the care. When you're sick, you want somebody to help you.
That's great. And a hospital, it's not a hotel, right? A hospital is a place where you're happy to see anybody who's able to help you.
Definitely, you're not there because you want to be there.
Yeah, my grandmother, my late grandmother, she would say it's not a hotel, and I myself, I've been in an orthopedic unit, and you're always happy to see the nurse. So I'm sure that there's a lot of oh, great, the nurse is here. It's never going to be an issue. And I guess to the point that Jason was making, I wonder, Jason, if you could talk a little bit about, because you've worked in psychiatric before, your experience as a nurse in a nursing home. Would you say that the trust is automatically, especially over time? Would you say it's a higher level of trust that you can sense based on the length of time that you might get to know a person, or do you think it's just it's sort of a similar situation?
Oh, it's a totally different ball game when you're looking after someone for years, right? It's you know their family, you know their ins and outs of them, all their diagnoses, all their meds. It doesn't mean you're best friends, but there's consistency involved. Versus psychiatry, it's also building relationships. So it's kind of, I also see a lot of, whether it's looking after someone who's acutely ill in the hospital or looking after someone in the nursing home, there's still that building that trust, that relationship, and providing the care that they need at the time, right? So you got to meet the person where they're at, and you got to be careful of your approach. Is my big thing.
you really have to meet where they're at and be intentional with your approach, I guess, is what
you don't want anything misconstrued. So I also you almost want to hold yourself to a higher standard professionally, especially when it takes one accusation to really derail some things or to take a side turn. So if you're always above board, you're always being professional, that's something that is in your favor professionally.
Absolutely. And I think that's the case universally, but maybe you could talk a little bit about how, your experiences as men. I get the sense that it's different, that it's a different motivation behind that desire to uphold the highest standards of professionalism for you than it would be for a woman nurse.
No, I don't think so. But, some people have some old school views that maybe men shouldn't be nurses. So you need to prove them wrong. And the up and coming young men out there, boys or whatever, if they see you as a nurse, they know, hey, and maybe that can be me someday, right? So you want to, it's one of those things where if they see it, oh, well, maybe that could be me. So, you're working for the public. You're a professional. You want to always be professional.
Absolutely. Are there moments where being a male nurse feels particularly noticeable to you folks? I'm sure, I'm thinking off the top of my head at the age, even in union interactions, at the bargaining table, at the AGM, at your 5% of the men in the room, of people in the room are men. And, is that something that feels noticeable to you, that strikes you any type of way?
Well, it's very noticeable when you go on a unit or in a union meeting or anywhere where a minority group automatically. But I don't see particularly issues with it. Like I'm not like Jason. I can't say I'm the most professional like he is. Like, but I think people appreciate male nurse. My peers, my colleagues, and even on the board, they like a different perspective, and it brings a good balance to the team wherever it is. Like it's a great mix, and I never felt ever not welcome or not appreciated ever in any settings or any group, for that matter.
Yeah, I echo Patrick's view. I've never felt that I don't belong. My colleagues have always been welcoming. It does bring a different dynamic when there is a guy on the unit working, or a couple of guys even. So I really, I don't notice it until it's pointed out. It's just me going to work another day. And it's like any of us going to work. That's what it is. And then, I don't notice unless it's pointed out, and I don't notice unless maybe I touch the thermostat that I'm not allowed to, because there might be a bunch of ladies going through menopause, and they'll get quite mad at me. So really, I don't notice. It's just that's work, and I love what I do as well. So.
Yeah, like Jason said, never touch the thermostat.
Never.
I got told that once. Like, you don't touch this. Who put the heat up by 2 degrees? And I never did touch it ever again.
Yeah, bring a sweater.
That'll be the title for this episode. Never touch the thermostat.
It would be appropriate.
No, that's very interesting, and it's good. By the way, I would like to echo: you feel welcome because you are welcome, and like I said, your insights are valuable. We wouldn't want to leave 50% of the talent on the table, and you definitely have a voice at the table in nursing, because we need nurses, and whether you're a man or a woman, it doesn't matter. And quite frankly, we probably could use a few more men in the profession. Just because of numbers, sheer numbers, and the work that you're, and the unique insight that you're able to bring, which hopefully, this time 50 years from now, it won't be unique, it won't be talked about, and there's many fields where that hopefully is the case, where it's more of an even 50-50 split.
Do I say like tomorrow it needs to be 50-50? No, like it should be whoever wants to be a nurse should be able to become a nurse if they have the competencies and everything like that. Like the last thing you want is nurses who don't want to be nurses, right? You want people there that want to be there, that want to help people, that have something to provide. So there shouldn't be any barriers, whether it's a 60-40, 70-30, 80-20, as long as the people that are there want to be there and they're doing a good job. To me, that's the most important part right now.
It's interesting that you bring that up. And I absolutely agree that, do you think there's something that could be done differently to make, I guess, I would imagine nursing is not a profession that is, so to speak, heavily marketed towards boys growing up, men who are entering the workforce. Would you say there's something that can be done differently to make the prospect of wanting to be there a little more attractive to boys and to men?
For nursing, there's such a wide different range of place you can work, different departments, different sectors in the community setting, in the hospital settings. And you can go at the federal. There's such a wide variety of career possibilities and with different schedule. And I think we have to be very transparent and promote all different sectors to the population, that there's a job for everybody. And like Jason said, if you're there for the right reason, go for it. You have to have the knowledge, you have to have the approach, and you have to have good intention to do a successful job, to take care of people in their most vulnerable time. And that's the main goal at the end of the day.
To promote, and I hope nobody probably offend a few people. I think it's very important that we celebrate where we came from, where the profession originated from, but also we got to be realistic on where we're at and where we want to go for the profession, and how to grow it and celebrate it. And I think it should be celebrated where we came from and in the history. But it to me, it's not a calling. I didn't wake up one day and say I want to be a nurse and felt the need to care for people or anything like that. It's a profession. Everybody's educated professionals. We have a license. There's education involved. There's training involved. There's upkeep in the training involved, just like any other profession out there that's self-regulated. So I think it's trying to treat it as a profession. Yes, we care for people that need care. We do that. But it is a profession. I think that might make it more visible, not visible, but might be more enticing to some folks if they see from that thing, if they don't feel a calling, right? Some people have a call. Some people might still have a calling, but for myself, there was no calling. I saw it as a profession, something I can make a difference in, but also support myself and my family comfortably.
You're absolutely right. It's not a calling; it's a profession. And Patrick, to your point, it's about the that is a very good point. The versatility of nursing. Our President Paula recently said something like, "Oh, if you don't like your job in nursing, try another job in nursing, because there's so much out there, and it's so much wider than people ever even realize." I'm sure there's a lot of people, even in the healthcare profession, not necessarily nurses, but who don't realize all of the different ways that you can practice that particular profession, and more versatility than is offered in most any other field.
Oh, it's wild. There's so many things you can do. You can go work on a cruise ship. You can work with babies. Don't like babies? Go work with older folks. You don't like older folks? You can do more of an administrative role, with EI or something like that, or benefits. Look, we're involved with the union part-time here. You work with your regulatory body. You can work in the community in a car, working on the streets. You can work in a hospital setting and then leave at 7 p.m. and not think about it till your next shift and have 5 days off. You can go fly in somewhere for 3 weeks or a month and then come home and have a month off. There's a boatload of stuff you can do. You can be a private business owner. You can run a special care home. What else could you do? You can own your own business. You can have a foot care business. You can have a medical esthetician, that kind of stuff. Not my thing. I can barely braid hair. But different things for different people. There's so many things you can do.
Absolutely. And that's fantastic. What do you think people often misunderstand about men in nursing?
I would say the caring approach, that they would assume a male wouldn't have any caring, which has really nothing to do with it. I think it's very internal, and your approach will be based on the teaching you learn and your personality and all of that stuff. And also, I find something that's very misleading with colleagues also. Every time there's heavy lifting, if you're the male, you're going to have to go do the hard work. You're going to have to lift something or turn somebody, or they will always go to you, which, well, I don't know if there's statistics out there, but I'm sure we're more prone to have a back injury than our female colleague, because I get called daily because I'm the guy. We need a guy here. We have a code white. That would be somebody aggressive. Oh, we need guys on this unit. Send guys. And my mom told me when I first started in the profession, make sure you don't go to everything just because you're a guy, because you will not be working for long.
Yeah, and that's pretty wild, because it send guys, and often I would imagine it's the case that you might have one or two in the whole place, probably more than that. I'm being dramatic, but it's not a wealth of choice. So it's true that you have to be careful. Like, hey, the professionals that I work with are all equally capable, and so it's disproportionate to lean on that side of things as often. So that's interesting. I'm sure that. One of the questions that I was going to ask was, like, do you think gender plays a role in how work is assigned or expected or perceived on a unit? So I suppose you've just said that it does play a role.
Oh, yeah, definitely. We'll get called from other units, from supervisors, that we have to send guys to a certain floor because they need people that are strong. And you shouldn't assume that the guy is stronger than the female, or it shouldn't be gender based. It shouldn't be at somebody's capability or capacity. Yeah.
The misunderstanding part, I just think people who don't know don't know. You know what I mean? Like, if you've never seen a male nurse, or you've never had a male nurse take care of you or a loved one, maybe you're just you don't understand that we all have the same qualifications. We can provide just as good quality of care. It might have a bit of a different flavor, but that's not based on gender. It's also based on who you are. It doesn't matter. It could be two different female nurses provide, different care than two different guys, right? So, and when it comes to assignments, there is some different assignments that guys get versus our female colleagues, but it's the same. If you got three different nurses and 10 patients, you're like, okay, this patient's going to respond well to nurse A, this patient's going to respond well to nurse B, or they already have a good rapport, or they looked after them last time. So you always try to pick the best nurse for the best assignment as well, right? Based on competencies and approach and stuff like that too. So
absolutely, and that's a very good point, because that's not even limited to just nursing. Two nurses can be completely different. And there's plenty of professions. Say a teacher. You can have two teachers that job is far from being a monolith as well. It's not, the approach will be different. And, the teacher that runs drama club might not necessarily be the same type of person with the same type of experiences and the same type of approach as the person who's coaching the football team. And that's just that's just how life works, really. It makes sense that that's how you see men and women nurses as having different experiences. It's not necessarily about gender. It's about who they are and what they bring to the table. When you think about the profession as a whole, what do you think nursing gains when there's a wider range of people within it? Would it be fair to say that you think it's good for nursing to have different perspectives and more men and more women and more people with different experiences?
100%. We're dealing with humans. The people we're looking at are comes in all shapes and sizes and colors, and the people that should provide the care should be the same. It should reflect the population we're looking after.
Yes, definitely. I second Jason. Like, it's very well said. Like, we have to adapt and provide good care, and adaptation and evolution of the constant changing healthcare system is inevitable. And I think we're progressing very well right now in a constant system that is changing. So I think we're on the right track. We made a lot of progress in the last even 10 years.
Absolutely. Very well said. And I guess just to, I don't know, bring it to somewhat of a conclusion, what would you want someone who's considering nursing today to know about the profession? And that can be for a man or a woman, anybody.
I would want them to know the opportunities you can have. I would want them to know that, specifically to the men, if you choose nursing, it doesn't put you in a pigeonhole socially. There's a lot to be gained from this profession. It's fulfilling. It is fulfilling. It could burn you out, but it's also fulfilling. I haven't regretted this choice in the last, I started the program almost 20 years ago. So I'm still, I still find fulfilling, and I enjoy going to work every day.
Yes, definitely. It is fulfilling, and even if they're thinking a little bit about trying it, go reach out to a hospital or a different sector you would like to try out and go do some shadowing for a day. Right now we have students from high school that come like almost daily to the units. Just it's like little shadowing clinicals just to see how the profession is and if it's something that would interest them. And try it out, and like Jason said, and you'll find your sector where you want to go. I still feel fulfilled with my job, except on Fridays when I have to work the weekend or the night shift, but that's something you can change. If when you want to change in your schedule, you do it. So
Absolutely. That's well said. And now I'm very curious, and I'll go on a tangent here. Do they just sit at the nurse's station and watch what goes on, or is it different than that? These shadows.
these shadows, they follow you. Like they will have to sign probably waves of confidentiality and everything before entering the hospital settings. But they come in the rooms with me, and they're from high school, and they'll see how we do stuff. And we always have to respect the patient's wishes. So I'll ask permission before having somebody there with me, and if they're okay, they can witness and see how it's doing on the bedside in the hospital settings. And some of them, they say it's not for them, but some of them are very intrigued and they want to know the why and why is this happening to this person. And you explain lab results and stuff like that, and they're very appreciative of that. If you think about it, I never dreamt that in grade 10 or 11 I would have been to a hospital doing that. I didn't have the level of maturity that these high school people have right now, and their interest in the profession, and they know the why thing. Like some of them, they do it because they want to see how the hospital setting is, but they want to do it in cosmetic, which is a big industry right now. But the outreach of it and the interest in the profession is amazing at what it is right now, that back then I could even see how it is before trying it at a job. So it's nice that we allow people to do that now.
And something else that we touched upon it a bit there when Pat introduced himself, but the growth you can experience in the profession, like you can do a PSW role, and then that education can be used to get your LPNs. And if you want to, you can use your LPN education to get your RN. So it kind of it all comes together if you so choose. And then even then there's NPs, or you can use your bachelor's degree to apply to a medical school or a master's program. So there's growth that can happen in the profession as well. You're not just pigeonholed unless you want to stay where you're at and you're content.
Absolutely. It's often spoken of as a great launching point or jumping off point. It's the evolution of it can really be very attractive to some people, because otherwise you really are kind of taking a gamble. There's plenty of professions where you really don't find out if you like it until you're on the ground. And for some, I can imagine for some people who are about to invest in their education financially, that's a bit of a hard sell. And so it is good that Patrick, what you were saying about the that we give people a glimpse into it.
Yes, because it's a big investment financially and emotionally. Like you have to really want it, because I remember my nursing school. It was something, but it's something I wanted. You have to really want it, but if you put your mind to it, you can accomplish anything, basically.
Entering the union world, can you talk a little bit about what led you to, first of all, even want to be involved? Was there a first exposure to it? How was that experience for you both?
Well, my first exposure, I remember being in school and seeing my mom being her seniors home down home, and being the president there, and having her union book and answer calls at night, and being very involved, and all have these post-it in her book that was so used. I was always very intrigued and questioned her about it. And she was telling me how important it is to know your rights and know what you can do and know what your employer's obligation are towards you. And I was very fascinated by it, because I would still call her to this day about union question, and even if I'm on the board here, and she's very knowledgeable. And that kind of piqued my interest, and I started to get involved on my own. She never pushed anything on me, and I think it's the best decision I ever did. And I'm continuing to grow and learn every day. And I'm very appreciative that I got the opportunity to do what I'm doing right now as a Part 3 rep.
Myself, I think subliminally, my first hockey team I played for was called OPSU. It was when I was like 5 years old, so I don't know if that really stuck. But once I got into nursing and started my first job here, I think I was starting to ask questions about, like, well, why do I make this amount of money, and why, who sets my working conditions, and what bozo said a Sunday evening is considered not part of the weekend when I'm trying to go to barbecues with my friends and stuff like that. So that kind of just piqued my interest. And then an opening came up on the local. You ask enough questions, they tell you to get involved. So that's where that went. And now, in the role, whether you're on the negotiating team or a local president or on the board, like we are, you're looking, instead of caring for your patients, you're caring for the nurses, right? You're looking after their health through their working conditions or their benefits. You're looking after them economically through trying to get whatever benefits you can, monetary gains and stuff like that. So it's just you're looking after the nurses instead of the patients at that point, in some regards.
In that sense, do you see it as an extension of just what it means to be a nurse? It's about extending that sort of professionalism and care, but just in a different way.
Yeah, you're advocating for them. That's another role of a nurse, right? You're advocating. So you're advocating whether it's a dangerous situation or trying to improve something in the workplace. Like you're advocating for your colleagues, people some you don't know, but that's my view on it. I guess you can say it's caring in two different regards. It's two different things, but there are some parallels.
Absolutely. I guess advocacy is really the word I was going for. So thank you for raising that. And I guess this question is really more for Patrick, because I'm curious about this, where, as someone in a union who works in a busy hospital, would you say that being involved in the union has helped expose you to more of the people that you might not necessarily work directly with, and to their experiences and to the things that they're facing, rather than, I can imagine, otherwise it would be relatively easy to be somewhat siloed, for lack of a better term. Would you say that it's helped you get to know more people? Would you say it's opened your eyes to different people's experiences?
Definitely. Like, even in different sectors like community or long-term care, like it's such a wide obstacles and challenges that every sector have, and every unit in different hospitals and different health authorities, because we all know both health authorities don't run the same way. And everybody has different challenges and issues that are specific to their place of work, which they have their president there to help them through. But as my role right now, I see the bigger picture and how everybody has different challenges but in the obstacles, but how we can work to make everything better. And we have a lot of work still to do, but that's what we're here for. We're here for the members and get them to the better working condition and optimal working condition they can get. And that's why we're here. It's for every member to protect them and to deliver safe care and to be able to be professionally do a good job.
Yeah, it's super interesting. Like Pat talked about big picture, right? Like you start learning who the shakers and the movers and how policies made and like trying to advocate or lobby government. You're not just for looking for just an example, hours of care in a nursing home, right? Yes, it benefits the nurses and the care staff by giving us trying to increase the amount of hours, but the primary driver of that is trying to provide better care and safe care, and the care that here it's New Brunswickers deserve, right? So we're not just focused on all the nurses, we're also focused on the public and New Brunswickers in general. So I think that's important. That's one of the things that they try to teach is look after the community as a whole. So there's a trickle down effect, whether it's advocating for more public health care funding, right? That has an ounce of prevention is better than a pound of cure, that sort of thing. So we also have the community in mind.
Yeah, definitely, Jason. It's like you said, better condition, better care.
100%. The public deserves that care too.
It's interesting, it's not unusual, but this is something that I'm reminded of again and again and again every time we do one of these podcasts, or anytime I spend any time like talking to a nurse, is that you folks hold yourselves to a very high standard. And at the end of the day, it's about providing the best possible care you can, and about doing a good job, and not necessarily about getting accolades, but whatever. And to me, that is then the essence of what union work is all about. It's about creating as smooth of a runway for your fellow nurses as possible, so that everybody can do a good job and everybody wins when it's like that. And you often hear our working conditions are your care conditions, and so it's very interlinked. And that's something that I see reflected in the attitudes around nursing from nurses themselves all the time. And what would you say your experience on, you're both members of the board of directors now. What would you say your experience on the board has been like in terms of the transition from, say, a local president, member of the local executive, to where you are now?
I joined last May, so I'm just past 1 year in this position. It's the lens that you're trying to bring, and you got to wear a hat, right? So before, my hat was I'm showing up and I'm just representing the nurses at my nursing home. Now my role is the nursing home rep. I'm representing every single nursing home. So, it's not just the problems that I bring from my workplace, it's the problems that all of the nursing homes are experiencing, and just making sure that in this big organization, that voice is heard at the table, and I'm representing them appropriately.
And as for me, like Jason, well, I really just started. I don't even have a full year yet in my position, but I love it. Because me and Jason, I can confidently say we're the youngest people of the board. And they need to prepare us because
we act the youngest too.
Yeah, we act the youngest, but they need to prepare us. Like people like me and Jason or anybody else that's going to be involved is just like we have to. Who's going to take over when everybody retires or stop doing this? So that's what they're doing with us right now, and I love it. And I can't speak for Jason, but I can tell he loves it, and he's very passionate about the union work he does. Like Jason's teaching me stuff and I'm teaching Jason stuff, and we're all learning from each other, and we all have a common goal. It's the members. So
yeah,
I love my first not even full year yet, and I hope to keep going because this is something I'm very passionate about.
Yeah. And something interesting too, because this is all about men in nursing, is our positions are elected. So Pat's got thousands and thousands of members in his bargaining unit, but they're predominantly women, and for whatever reason, our colleagues they put trust in us to be their voice at the table. So That also speaks to our place and our belonging in this profession.
Absolutely. And, with regard to to what you said about, your relative youth on the board,
Yeah.
it's about bringing up the next generation. And I'm sure that in some respects it can be a steep learning curve, but it's fantastic that you both are up to the challenge and want to carry that, and want to carry your perspectives forward and see it through over time. So it's good that you're both so committed to the cause.
Yeah, I mean, I've had a few. I don't know about you, Pat, but when I first started, there was a couple of older gentlemen that kind of mentored me, and I'm try every time I see a younger man or a new nurse. It doesn't just have to be a young man, but come through. You want to make sure that you check in with them and provide them support that they need to flourish.
Yes, definitely.
And it's like we said before, the fact that your peers put trust in you, it's because you do belong, and you do have an important voice at the table, and it's good that, like I said, you're so committed to the cause of advocating for each other and for your patients. Is there any last thoughts you'd like to share, or do you feel you've said it all?
Try the profession. If it's something you want to be, go for it. Don't let your gender determine whether you're going to be a good nurse or not. If you're meant to be one, you'll be one.
Yeah, it's not a calling. It's a profession. There is a place for men in nursing in multiple different specialties and areas. It's fulfilling. Being in a place of trust when it comes to caring for someone, whether it's someone being born or someone dying, right? Or you see people at their worst, and you're there to pick them up and provide them what they need to get better. So it's give it a try. If you maybe ask first before you try something, but yeah.
Absolutely. Well, thank you both for sharing your experiences. It really adds a lot to our understanding of what the profession looks like across different perspectives, across different practice areas. To everyone listening, thank you for being a part of this conversation. Conversations like this are one way we strengthen nursing as a profession by understanding each other's experiences and the realities of work across New Brunswick. So I encourage everyone listening to stay connected, watch for updates on our social media channels, in your email inbox. And to all those working in healthcare, thank you for the care, skill, and dedication you bring to your patients, your residents, your communities of New Brunswick every day. So thanks, everybody.